But despite these grim scenarios, can we at least say that more individuals in Massachusetts now have coverage, just like more Americans will ultimately have coverage when this reform is fully implemented? The answer is technically yes. However, while close to 100% of Massachusetts residents are covered, the reality in Massachusetts is that many are having significant difficulty accessing the healthcare system. As evidence of this, emergency room visits in Massachusetts have gone up following reform. Weren't they supposed to go down if healthcare access improved? It would seem then that access has actually gotten worse. And finally, the Massachusetts plan exceeded its projected yearly cost by 10% in only its third full year of operation.
Let it fail.
All of these results from Massachusetts provide an ominous prognosis for the recently passed health care bill, which is already projected to increase national health expenditures by $222 billion over the next decade. As Massachusetts is quickly finding out, the kind of health care reform signed into law by the President in March is fiscally unsustainable. But worse yet, it will continue to drive a wedge between patients and providers. In short, it will worsen access to health care for the majority of Americans while making an already dire fiscal situation driven by $76 trillion in unfunded entitlement liabilities worse. But there are alternatives to the Democrats' massive health care overhaul that have been clearly elucidated by the likes of Wisconsin Congressman Paul Ryan. Rather than expand the role of government in the healthcare market, these conservative alternatives, which were never taken into consideration, implement a patient-centered, consumer-driven, free market approach to healthcare reform that will drive down costs and incorporates these 5 basic principles. Number 1, we must begin with individual ownership of insurance policies to ensure that all Americans have the same ability to purchase portable, affordable coverage that best suits their needs.
Yeah.
2, we must change the present tax code, which discriminates against individuals who do not obtain coverage through their employer and are thus required to purchase health insurance with after-tax dollars. Number 3, we must allow interstate purchasing of insurance and eliminate mandated benefits that insurers are required to cover, and instead allow individuals and families to shop across the country and choose what health care plans best suit their needs. 4, we must also eliminate unnecessary scope of practice laws and allow non-physician healthcare professionals to practice to the extent of their education and training. And finally, number 5, if we are to lower healthcare costs, we must reform current lawsuit abuse practices. The Massachusetts Medical Society found that 83% of physicians surveyed reported practicing defensive medicine. An estimate from the Pacific Research Institute puts the cost of defensive medicine at more than $200 billion annually. According to former Democratic National Committee Chairman and physician Howard Dean, the Democrats did not address this issue in the current health care reform bill because they did not want to take on their biggest campaign contributors, the trial lawyers. We must put an end to this political cronyism in Washington in the interest of lowering health care costs for all Americans. These conservative reform ideas would permanently bend the cost curve down while respecting the foundational American principles of individual freedom, personal responsibility, and limited government.
That's it.
But to achieve this type of reform, we must vigorously support candidates in 2010
Yes.
who seek to repeal, defund, and replace the recently passed health care bill. The health care bill recently signed into law by the President expands the federal government far beyond its constitutional limits. It will require massive new taxes and regulations. It will dramatically worsen our already deteriorating economic and fiscal conditions. It will make millions more Americans dependent on government, and in doing so, it will irrevocably impair the identity of this country. We must put an end to this out-of-control government by continuing to unite in peaceful demonstrations and by making our voices heard at the voting booths this November. Thank you all for coming out.